Good morning, dear friends. We will continue today's class multiple choice questions. Most commonly used urinary catheter is right answer आपका होगा Foley's catheter. Identify the given image. Right answer है आपका Foley's catheter. Identify the given image. Option A Melicot catheter. मेलिकोट कैथेटर में आप देख सकते हैं कि आपका आगे का जो पॉइंट है वो देखिए, ये ओनली फॉर किस लिए होता है, ड्रेन के लिए होता है. इंडिकेशन फॉर Foley's catheterization इंक्लूड ऑल एक्सेप्ट. राइट आंसर है ऑप्शन सी इन प्रिपरेशन फॉर अ लॉन्ग ट्रेवल. Which one of the following interventions the nurse would carry out first before inserting the catheter? Right answer option A clean the perineum from front to back. COTI catheter associated urinary tract infection bundle of care is used for patient. Option D with Foley's catheter. Nursing interventions designed to decrease the risk of infection in a patient with an indwelling catheter includes. Right answer आपका है option A cleans area around meatus. Which of the following is a primary nursing interventions necessary for all patients with a Foley's catheter in place? Right answer है आपका option B D maintain the drainage tubing in collection bag below bladder level. What nursing action must be taken to prevent hospital-acquired urinary tract infection among patients who are on indwelling urinary catheter? Right answer आपका होगा option D 24 hours. Next question. 1 pint of 10% dextrose yields how much calories? Option B 200. 1 pint is equal to 500 ml, so 1 pint of 10% dextrose contains a total of 50 gram dextrose. 1 gram sugar provides 4 calories, as a total of 50 grams will give 200 calories. 1 liter contains deciliters. Option B 10. 1 लीटर में होता है 10 डेसीलीटर. In the report, the nurses is told that one of her patients has been ordered nil per oral after midnight. The nurse should option A take away the water pitchers at midnight. Nil per oral means non-eating, drinking including water. Nil per oral or nothing by mouth starting from at midnight. Which of the following medication order is administered immediately and only once? Option C state order. State order means single order but it is given immediately, and PRN order Prodineta means when required as needed. The document that gives nurses the authority to carry out specific actions under certain circumstances, often when a physician is not immediately available, is called option A standing order. Standing order is a written order, rules, regulation, protocol or procedures prepared by the professional staff of a patient or clinic and used as guidelines in the preparation and carrying out of a medical and surgical procedures. What is the time frame within which the telephonic or verbal order for medication should be verified? Option D 24 hours. What is the meaning of PRN in medication administration? PRN means option D when required. Symbol used for drug administered before sleeping at bedtime. Option B HS नाइट टाइम. सिंबल आप देख सकते हैं. HS होरास ओमनी मीनिंग एट बेड टाइम. HN हैक नॉक्टी टू नाइट. SOS C ऑपर सीट इफ नेसेसरी इन इमरजेंसी. OM ओमनी मैन इच मॉर्निंग. ON ओमनी नोट इच नाइट. AC एंटीसिबम बिफोर मील्स. PC पोस्ट सिबम बिफोर आफ्टर मील. Which of the following medication order are for every other than? Option C QOD. OD omnidie once a day, BD bisindie twice a day, TTS titindie thrice a day, QID quaternindie 4 times a day, QOD quarter ultra die every other day. While administering a medication to a client, a drug is to be administered AD. What does AD refer to? Option A, right ear. AD right ear, AS left ear, OD right eye, OS left eye, OU both eyes. The part of the syringe which holds the medication is called option D, barrel. Identify the correct angle of insertion for different parenteral rule. Option A, 10 degree is for an intradermal injection. इंटरनली होता है, आप लगाते 5 to 15 डिग्री, IV 15 to 45 डिग्री, SC सबक्यूटेनियस 45 और 90 डिग्री, इंट्रामस्कुलर 72 to 90 डिग्री. ओके, आप निडल साइज देख सकते हो. इंटरनली में 25 to 27 कोर्स का यूज़ कर सकते हैं, IV 18 to 21 कोर्स एंड सबक्यूटेनियस 25 to 29 कोर्स, intramuscular 21 to 23 goes. You can see intradermal injection is given at option A, 15 degree. The nurse should hold the syringe almost flat against the patient's skin at 15 degree with the bevel of the administering a intradermal injection. Which gauge diameter of needle is used for intradermal injection? राइट आंसर है आपका ऑप्शन डी, 26 gauge. Order is 180 mg of cefotaxime intravenously available from a form is 500 mg per ml. What is the amount of medication to be administering using a 2 ml syringe with 10 divisions per ml? राइट आंसर है आपका 18 डिविजन. इंटरनल में आपका इंजेक्शन का नीडल साइज क्या होना चाहिए, यहाँ देख सकते हो आप. इंटरनल में 25 to 27, जिसमें राइट आंसर आपका होगा 26. Subcutaneous administration distributes medication into the fatty layers. Subcutaneous injection is administered option B, hypodermally. In hypodermic subcutaneous injection, the skin is pinched between thumb and 4 fingers of left hand and needle inserted at option D, 90 degree. Slow infusion of isotonic fluid is into subcutaneous tissue is called option A, hypodermocyclosis. For intramuscular injection, the nurse should insert the needle into the muscle at an angle of. इंट्रामस्कुलर में आप कौन सा डिग्री एंगल पे लगाते हैं, 90 डिग्री. ऑर्डर इज 180 mg. इसका राइट आंसर है ऑप्शन बी, 18 डिवीजन. Infusion therapy, the size of the IV cannula for neonate is option D, 24 gauge. What is the color of peripheral venous cannula of 16 gauge? Right answer is option B, grey. Color code of IV cannula: orange 14 gauge, grey 16 gauge, green 18 gauge, pink 20, blue 22, yellow 24 and purple 26 gauge. Which of the following is not a precaution to be taken in case of a patient with central IV lines? Option C, changing line every day. Normal saline is an option A, isotonic solution. जिससे आप आइसोटोनिक सॉल्यूशन देख सकते हैं. सलाइन एनएस आपका आइसोटोनिक सॉल्यूशन है. रिंगल लेक्टर आइसोटोनिक, डेक्सट्रोज आइसोटोनिक एंड डेक्सट्रोज सलाइन 5% आइसोटोनिक एज हाइपोटोनिक सॉल्यूशन देख सकते हैं 0.45 डिग्री सलाइन, 0.33, 0.225% सलाइन, 3% सलाइन, 5% सलाइन एंड 10, ये सब क्या है हाइपोटोनिक है। और 3% सलाइन से आपका हाइपोटोनिक है, 5% हाइपोटोनिक, 10% डेक्सट्रोज, हाइपोटोनिक 5% डेक्सट्रोज, हाइपोटोनिक 5% डेक्सट्रोज इन 0.45 डिग्री सलाइन हाइपोटोनिक। विच ऑफ द फॉलोइंग IV फ्लूइड इज एन आइसोटोनिक सॉल्यूशन? आपका राइट आंसर है रिंगलेक्टेड। विच टाइप ऑफ सॉल्यूशन कॉजेज वाटर टू शिफ्ट फ्रॉम द सेल्स इनटू प्लाज्मा? ऑप्शन डी हाइपोटोनिक। Plasmolysis will occur when the cell is placed in option C hypertonic solution. The osmolality of 0.45% sodium chloride is option A 154 millimole molecular per liter. Right answer option A. Most frequently ordered in conjunctions with furosemide latex potassium. Which purgative causes hypokalemia? Option C है castor oil. A nurse is preparing to care for a client with a potassium deficit. The nurse reviews the client's record and determines that the client is at risk for developing the potassium deficit because the client, option B, is on nasogastric suction. Spironolactone produces, option B, hyperkalemia. A patient had an extensive and prolonged surgery. Which electrolyte should be monitored most closely? Option A, potassium. A nurse caring for a group of clients reviewed the electrolytes lab result and notes the potassium level of 5.5 milligram per liter. The nurse understands that which client is at most risk for development of a potassium value at this level. Option D, client who has sustained a traumatic injury. Which of the following electroconvulsion therapy finding indicates the presence of hypokalemia? Right answer है option B, ST segment depression. आप देख सकते हैं इसी चेंजेस ड्यूरिंग हाइपोकेलेमिया इंक्लूड ST सेगमेंट डिप्रेशन, फ्लैट और इन्वर्टेड T वेव, प्रोमिनेंट U वेव. इसी चेंजेस ड्यूरिंग हाइपरकेलेमिया इंक्लूड्स टॉल पिक्ड T वेव, प्रोलॉन्ग PR इंटरवल्स, फ्लैट और एब्सेंट P वेव एंड वाइडेंड QRS कॉम्प्लेक्स. टॉल टैलेंटेड T वेव एंड वाइडेंड QRS आर सीन इन आपका ऑप्शन आंसर क्या हो सकता है? जब टॉल टैलेंटेड T वेव एंड वाइडेंड QRS आर सीन इन हाइपरकेलेमिया. %40 in 10 liters नर्स देख सकते हैं इस तरीके से. व्हाट इज द What is the advantage of Venturi mask? Option B, deliver precise and high flow rate of oxygen. For a COPD patient in ICU, following is preferred device for oxygen supplementation. Option C, Venturi mask. Maximum oxygen delivers to patient by which route? Option D, by non-rebreather mask. The device that can deliver oxygen at concentrations of 90 to 100% is the option C, non-rebreathing mask. Identify the oxygen delivery system. Option D, non-rebreather mask. Percentage of oxygen delivered by use of a non-rebreathing mask with a low rate of 10 liters per minute is option D, 90 to 95%. A client requiring the highest possible concentration of oxygen will need which of the following delivery system? Option D, mask with reservoir bag. Highest oxygen concentration will be delivered by option C, partial non-breather mask. The nurse is administering oxygen to a client with chest pain who is restless. What is the method of oxygen administration that is least likely to increase apprehensive in the client? Option D, rebreather mask. Which forceps are non-traumatic? Option B, Babcock forceps. Identify the instruments. This is Babcock forceps. Identify the instrument. Bar Parker BP handle. Bulldog clamp are used in surgery of blood vessels. राइट आंसर आपका होगा 1007. राइट आंसर आपका ऑप्शन ए, ब्लड वेसल्स. Bulldog clamp is fine tipped spring loaded forceps used to grip and hold sutures, tissue or vessels. Meningote clamp is used in option B, hysterectomy. Caldwell Luck operation belongs to option A, ENT surgery. Identify the use of given instrument. This is option A, to hold sponge and gauze. Identify the instruments. This is Chitter's forceps. Use of cautery prohibited with option B, ether. Cautery is a device used to control bleeding or cut the tissue by electricity. Electrocautery, galvanometer cautery, freezing, heat thermal cautery or corrosive chemicals. Ether vapor used in cautery may set fire, so it should be prohibited. Identify the instrument. This is circular stapler. Identify the instrument. This is linear stapler. You are a post-operative nursing care. You are a nurse assigned in a recovery room or post-anesthetic care unit. The main priority of care in such area is option A, keeping airway intact. A client arrives from surgery to the post-anesthesia care unit. The nurse should complete which of the following respiratory assessment? First, airway flow, breath sound, respiratory rate, oxygen saturation. इसका राइट आंसर है ऑप्शन A. Option A is the airway flow. Miss Anita asked the nurse when she can start eating after surgery. What is the most appropriate response by the nurse? Right answer option C. You will likely start on clear fruits once bowel sound can be heard. After a child returns from post-anesthesia care unit after surgery, which of the following would the nurse assist first? Option C, surgical site dressing. Post-operative wound is observed for option C, bleeding and discharge. The nurse is evaluating the client in the post-anesthesia care unit and determines that the LRAT score is 8. Based on this assessment, the nurse anticipates that the client will option B, be discharged back to his or her room on the nursing unit. A drain that is used for drainage of bile after an open cholecystectomy is option D, T-tube. Which actions by the nurse in charge is essential when cleaning the area around the junction Pratt wound drain? Right answer आपका होगा option A, cleansing from the center outward in a circular motion. Identify the given image. Right answer है आपका junction Pratt drain. Orthopedic procedure, a strip of material used mainly to support and immobilize part of the body is called as option A, bandage. Match list 1, list 2 and select the correct answer using the code given below the list. राइट आंसर है ऑप्शन ए. और चेस्ट आप देखोगे 10 to 15 सेंटीमीटर होना चाहिए एंड थाई है 8 to 9 सेंटीमीटर. हेड 6 to 8 सेंटीमीटर एंड रिस्ट 5 सेंटीमीटर. हाउ बैंडेज शुड बी ड्रेप्ड? ऑप्शन बी, डिस्टल टू प्रॉक्सिमल. While draping the bandage on the arm, how much each succeeding layer should cover up the previous layer? Option C, 50%. The reverse spiral bandage is applied to part of the body where the circumference option
D, B and C is the right answer. B is even and C is uneven. टी बैंडेज यूज्ड फॉर, टी बैंडेज हम किस लिए यूज़ करते हैं? इंक्रीज वेनस रिटर्न टू हार्ट, सपोर्ट लिमिट, सपोर्ट द एब्डोमिनल ड्रेसिंग, सपोर्ट द रेक्टम एंड पेनियल ड्रेसिंग। तो आपका राइट आंसर क्या होना चाहिए? टी बैंडेज इज यूज्ड फॉर सपोर्ट द buttocks are slightly elevated from the mattress to provide quarter traction. It is mainly used to treating the fracture shaft of femur in children below 2 years of age, weight below 15 to 18. The right answer is support the rectum and perineal dressing. A 2-year-old child is placed in Burnett's section for treatment of fractured femur. The nurse develops a plan of care for the child. Which of the following is not a component of the plan? Right answer: ensure that the sacrum is resting on the mattress. An 18 months old has a fractured femur and is in Burnett's section. To evaluate correct application of the traction, the nurse should note that option B, the child's buttocks are raised slightly. A child with femur fracture temporarily placed into skin traction. During assessment, the nurse note the absent dorsalis pedal pulse in left foot. What would be initial action taken by nurse? Right answer is option C, inform the doctor immediately. Which of these measures should be included in the care plan of a patient whose left leg is in flexion? Right answer is B, option B, noting the color of the toenails after applying temporary pressure. An example of cervical skeleton traction device is option A, Halo device. Which of the following device instrument is used in cervical spinal cord injury? Option A, Halo vest. In a case of drowning, all the following first aid measures are indicated except option A, allow the patient to sit up. The endotracheal tube is put into the option C, trachea. Endotracheal tube is a short-term artificial airway, and tracheostomy tube long-term assistant is inserted into the trachea to gain control of the airway. Identify the procedure shown in the image. Option A, endotracheal intubation. Appropriate size of endotracheal tube used in adult is 8 to 9.5 mm. Right answer is option B. ET tube size according to age are: newborn 2 to 3 kg, 2.5 mm to 4 mm, infants 4 mm to 4.5, children up to 10 years 5 mm to 7 mm, children about 10 years 7 mm to 8 mm, adults 8 mm to 9.5 mm. ET tube in formula of uncuffed tube for child age in year above by 4 plus 4. आप देख सकते हैं अनकफ्ड ट्यूब एज इन ईयर अपॉन 4 प्लस 4 mm एंड कफ्ड ट्यूब एज इन ईयर अपॉन 4 प्लस 3.5 mm. ET ट्यूब डेप्थ इज इक्वल टू ETTT endotracheal tube size into 3. What should be the size of the ET tube for a newborn weighing 2000 to 3000 grams? Option D is the right answer, 3.5. For tracheal intubation of a child of 6 years, uncuffed tracheal tube of following size would be appropriate? Option C, 5.5 mm intradermally. आप देख सकते हैं कैलकुलेशन 6 ईयर का है बच्चा, 6/4 प्लस 4 mm, तो आप कितना आंसर करना है? 5.5 mm. इंडोट्रेकियल इंट्यूबेशन इज यूज्ड इन ऑप्शन ए, जनरल एनेस्थीसिया. For tracheal tube insertion in a newborn, following is the combination of tube and laryngoscope blade. Option B, uncuffed tube with straight blade. What is the instrument shown below? Option B, tracheal dilator. The healthcare provider is caring for a patient on a ventilator with an endotracheal tube in place. What assessment data indicate the tube has migrated too far down the trachea? Option A, decreased breath sound on left side of chest. Tracheostomy usually performed between the tracheal rings of option B, second and third. In low tracheostomy, trachea is incised through the second and third tracheal rings of cartilage. In high tracheostomy, trachea is incised at a higher level, that is, at the isthmus of the thyroid. To clear the airway after tracheostomy, the nurse should do option A, suctioning. For tracheostomy patient, how often suctioning should be done? Option B, as needed. Before doing suctioning, it is not necessary to check the temperature. Nasotracheal suctioning is contraindicated in case patient is having option A, laryngeal edema and spasm. The nurse should lubricate the catheter used to suction a patient's tracheostomy with sterile option A, water. By performing endotracheal suction is an adult, you will ensure that you apply suction for only 10 to 15 seconds at a time. Thank you.